Good day. This is the Brooks Rehabilitation Stepping On Fall Prevention team, presenting you with some helpful tips for health, wellness, and fall reduction. The presenters are Bonnie Reguglia, PT, Janice Stem, PTA, and myself, Ola E. Warren, physical therapist. Next slide, please. My first helpful tip is exercise. Research has shown that exercise can prevent falls in older adults. It's important that older adults do not engage in walking alone to reduce falls, but that you supplement your walking with adequate amounts of strength training and balance training. The strength and balance training must be progressive and intense enough to have effects on reducing falls during upright activities and walking. It is important that you consult with a physical therapist to screen you for falls and to assess and provide you with the appropriate exercises for your strength and balance training in order for this to be safe and reduce your risk of falling. Next slide, please. My next helpful tip is medication management. 3 in 4 older adults take at least one medicine that is linked to falls. As we age, our bodies process what we eat and drink, including medications, differently. A medicine that worked well in the past could start causing side effects now or in future. Some of the side effects of medications include, but are not limited to, changes in your vision, changes in your awareness, loss of balance, a slower reaction time, muscle weakness, increased tiredness, and sleepfulness. It is important that at least once a year, you ask your doctor or your pharmacist to review all your medications. At least once a year, take a full list of your medications to your doctor or your pharmacist, or take all the medications in a bag. When you get there, some important questions to ask are, what's this medication used for? Does it interact with any other medications I am taking? Could this or these medications have side effects that will cause me to fall? Is there any other medication option that I can possibly take? Another thing to bear in mind is not to just go ahead and purchase over-the-counter medications or start taking herbal supplements without consulting with your pharmacist or your doctor first, because even those over-the-counter medications or herbal supplements can interact with your medications and increase the side effects of those medications that can cause you to fall. A few safe things to do are to carry a list of medications wherever you go. Only take the medications as prescribed, and never share your medications with other people. Thank you. Next slide, please.
Good afternoon, this is Janice Stam. I'm here to talk to you about the helpful hint about osteoporosis. This particular disease is also known as the silent killer, silent disease, in terms of we can have osteoporosis and not even know that it's occurring. Most instances occur in women more than men. However, decreases of normal hormones in the body, such as estrogen or testosterone, can contribute to this occurring. Also, other risks include a family history of osteoporosis, a very thin body structure, smoking, alcohol, and even some medications can increase risks. Common fracture injury sites include hips, wrists or upper extremity, and compression fractures of the spine. Research shows that specific exercises can be helpful in decreasing bone mineral density, increasing fall risk and bone mineral density. Medications can be prescribed by a doctor once your testing has been verified through a bone mineral density test. Weight-bearing exercises are best for improving our bone mineral density most effectively. People can do those by walking, step-up exercises, squatting, upper extremity press-ups against the wall. Any of those forms of weight-bearing exercise can increase bone density. Doctor may want to prescribe medication to help you as well, but that would certainly be up to your particular case and what may be advised. So I would recommend that physical therapists get to evaluate you and determine which exercises will benefit you most in terms of helping you with your osteoporosis. Next slide, please. My next helpful tip is about assistive devices. Most times people will use assistive devices to help them after a surgical procedure or when they have decreased balances due to any kind of neurological impairments. And there are many, many assistive devices out there that can be extremely helpful. They are helpful in navigating stairs, navigating uneven terrain, going up and down curbs or ramps, and they are definitely part of a medical management team to help determine which assistive device would be best for you. That would be determined mostly by the physical therapist. And in the beginning, you may need more assistive device use and then gradually progress down to something that's less supportive as you progress. Some people may need to use the assistive device indefinitely. We would make sure that when you are trained on an assistive device that you know how to ascend and descend stairs with the right sequence, and making sure that you're safe in using that device for those types of negotiating properties. I would say that we're going to determine that this will be the end of this part. I can't believe it.
The next helpful tip is going to have an annual vision exam. Older adults are at an increased risk for multiple pathological conditions. In fact, in 2020, this year, it's estimated that 3.3 million older adults will be diagnosed with glaucoma, 7.2 million older adults with diabetic retinopathy, and 30.1 million older adults with cataracts. A vision assessment that is performed annually can have multiple components, but we want to make sure that they definitely include visual acuity. As you're looking at this slide, you'll be able to see that there's a chart in the upper left-hand corner. We call this the Snellen chart. That's going to help to assess our clarity of vision, being able to read the small details with precision. We also want to be able to be assessed for our peripheral vision. Peripheral vision loss may result from a condition such as glaucoma. Central vision loss, on the other hand, can result from a condition such as macular degeneration. Our vision assessment should also include light sensitivity, motion detection, as well as sensitivity to glare. Again, as mentioned, there can be other types of conditions that are assessed for and other components, but those are definitely going to want to be included. As we are thinking about our vision loss, the most common cause of vision loss, the leading cause of legal blindness, is going to be age-related macular degeneration, also referred to as AMD. There are two different forms that we want to talk about today. The mild dry form that is going to affect 1 in 3 older adults, women having a greater risk, and then the more severe exudative form. Now, for the mild dry form of the 1 in 3 older adults who are affected by this, 10% can develop the more severe form. For those who have exudative age-related macular degeneration, they're going to experience partial or complete loss of central vision in the affected eye. So as they're going for their annual assessment, they might see changes in their visual acuity or even report changes in their quality of life. For the next slide, we're going to look at the helpful tip that will be related to home safety. And so as you're thinking about your home environment, I'd like to tell you about a study that occurred from October 2002 to December 2007. The study is called the SAFE Research Study, or Safety Assessment for Elders Research Study, that occurred in Dane County, Wisconsin. 500 older adults were enrolled, and they found that 2/3 of falls occurred inside the home environment. When we're wanting to know where did they occur, the largest proportion of falls occurred in the living room and in the bedroom. Falls also occurred in the bathroom, and those falls were 2 times as likely to result in an injury compared to falls in the living room environment. So if you're thinking about your home and how to make it safe to reduce fall risk and be able to promote health and wellness, you may consider an in-home safety assessment. If you have previously had a fall and been injured, this can be covered by Medicare. Also, your local Council on Aging may provide services that they can connect you with for an in-home safety assessment. This assessment may recommend getting assistance from another person or also using or installing safety equipment. Safety equipment could include non-skid bath mats or having a grab bar inside and outside of the tub or shower, or even a raised toilet seat. In conclusion, we also want to realize that falls occur outside of the home, and so being safe outside of the home. A research study found that this is going to occur more often for those active older adults. Finally, we have our helpful tip wrap-up slide, and so as you're looking at all of the information that has been presented to you today, we hope that you were able to take away some helpful tips that you can incorporate into your life to reduce fall risk and promote health and wellness. We also have a few resources that you can look at your leisure, as well as our references on the final slides. We thank you for spending this time with us, and we wish you an enjoyable Fall Prevention Awareness Week. Thank you so much, and we're going to stop recording.